Oh my God, I am so happy I got this surgery, man. Oh my God. I've just been so happy the last couple of days. So, I did my first Thanksgiving party, and I thought I had messed up the turkey. I cooked it upside down by accident. But it was like the juiciest breast meat ever. So a friend of ours came over who was also a bariatric patient. He's like, no, you got to open up the skin and put a bunch of butter and rosemary in there. And so I did that. But I did that on the back of the chicken. And I think I was supposed to do that on the breast. I don't know. And so we cooked the turkey for, the recommended amount of hours. And then we all realized, oh my God, the turkey's upside down. So then then we flip over the turkey and we cook it for another like half an hour just to brown the top. Oh my God, this was the juiciest turkey. But I do have a brand new oven, and I think having a new oven does kind of change, the quality of the food, because I was talking to my mother-in-law, and she had made a pie in her oven, which is a nice, really new oven, and she made it at somebody else's house, like some friend of hers in California, and she's like, the pie came out horrible. I did exactly what I usually do. So I think it really, having a really new, nice oven can really do some wonderful things. So why am I so happy? Oh my God. So had my Thanksgiving, 8 things that usually cause me problems and didn't have problems, and I'll explain to you why. I'll explain. So I had a glass of wine. Usually that gives me really, I just start feeling, everything just kind of feels puffy and just irritated and heartburny. I don't know how to explain it. So they had the red wine, had desserts, had early in the morning, our friend came over and he made biscuits and gravy. It's become like a new tradition. So I had biscuits and gravy, and I had like 2 servings. But I was like on my feet all day, and the day before I cleaned the whole house and I cleaned out the guest room. We bought a new mattress. We put in the new mattress. I've been like really been on my feet all week, and I lost weight. But yes, going back to the heartburn thing. So what I started doing, I stopped taking my pills. I'm going to still take them, but I don't know if I stopped kind of like, I was really good. I had like a pill box and everything was in there, and I would take everything. And then I just kind of, you get off track and you kind of stop taking them, but then, like missing a day turned into a week, and then it turned into 2 weeks, and I haven't really taken many pills. Maybe here and there I'll take my B12 or biotin. It really sparsely taking the pills. And my heartburn has been going away. And so I'm assuming one of these pills I've been taking every day for months and months and months has been causing my heartburn. So I did some research and found out that I wrote in medications that can cause heartburn. And you got your aspirin, and even I think like Tylenol. I think like calcium medications like Boniva. I think it's called Boniva. Those can cause problems, but I don't know if that's in the same category as like taking calcium. Could be. And they also say iron. And I was told by my surgeon probably, I don't know, probably once the heartburn really started getting bad, around that time, I was told to take an iron supplement extra, besides my, take my multivitamin, also add on an iron pill. And so I've been taking that iron pill, taking all my pills, and I've been slowly developing like this, like every time I eat certain foods, I just feel like shit. I feel like I want to throw up, or I'm not really going to throw up, but just, and my husband's like, this isn't right. You shouldn't be sick all the time. And for the past week, I've been feeling great. Like I I had Thanksgiving, tried everything, really, really tiny portions, did a lot of exercising, did a lot of walking around, drank some wine. Usually I try to stay away from alcohol because I feel horrible afterwards. Didn't have a problem. Was gonna go and have another glass of wine, but then my glass got kind of, I put it down somewhere, and then I think someone put it in the sink, and then I never went and grabbed another glass. But I think that it might be the iron pill. But I think I'm going to start off taking my calcium this week, see if anything happens. And I'm going to start adding in things, see what happens. But, maybe if I just eat with my pills, which I don't do, that would help. But I gotta say, it feels great. I'm like, I don't know if I want to go back take my pills. It's like, if I feel this great right now, I'm like, but I'm sure, not taking your pills for a long period of time is not good for you, and you'll start to feel kind of weak and, sickly or whatever, and maybe hair will fall out more, What else? So yeah, I've been feeling really great. I'm kind of like 2 pounds away from my goal of 150, which is like closest I've been so far, and it's really great. And what else? There was something else I wanted to say. I guess that's it. But yeah, I have a feeling it's the iron pill that's doing it, because I think I had been taking all my multivitamins and everything and for a while, and it wasn't until like 3 months in they told me to start taking an iron pill. And that's what I felt like the heartburn was starting to kind of get worse and worse and worse. So, oh yeah. So the past like 3 weeks, I've had some kind of urinary tract infection. They aren't like they used to be. Before surgery, when I would get a UTI, it would be like this burny thing, and now it's just kind of like a strange odor to the urine, and I've had it. I think it's going on for like maybe 3 weeks now, and I had this exact thing happen to me months and months ago, and I started to get kind of like a lump in my groin because probably a lymph node is getting kind of swollen from trying to like fight off this thing. But I should be going to the doctors, but my husband's trying to deal with the insurance right now because we don't have insurance at the moment because we got denied. We tried to get like a cheaper insurance because we aren't huge, heavy people anymore, and we're healthier. And I thought, hey, let's get something cheaper. Because before we had to, in order for Al to really get covered as somebody who was over 500 pounds, he had to pay so much money. And now we're like super healthy. We're not on any kind of, meds for our heart or anything. Or I never was, but he was on all kinds of different, things for his blood pressure and whatever. And now we're super healthy, and now we get denied. Oh, you guys had surgery. We don't want you. And I'm like, okay. So I should be getting some antibiotics for this whole infection, which probably got caused by not drinking enough water. But I've been trying to like treat it myself with cranberry juice, cranberry pills, and it's not doing the trick. I need the good stuff. But I feel like I'm kind of doing something by drinking, and it's keeping it kind of at bay. But now I'm starting to feel kind of like a soreness in my groin again, like I did last time. And I'm like, ow, time to make some phone calls. He's just been really busy with work, and he hasn't been able to, get to that. But it's time. I don't want to start rotting out of my, bleh. Anywho, but yeah, I'm in a great mood. I'm just so happy, so thankful that I got this surgery. Sure, my hair has fallen out, but it's still there, and no one can, there's no bald spot or anything. Sure, I get, urinary tract infections, but I have outgotten them my whole life. This isn't something new. But but they're a little more intense now because the horrible things I would do to my body by not drinking enough water kind of gets magnified because you're not absorbing as much water as you used to. But it's nothing that if I, tried harder, it would be fixed on its own. So, I'm just so happy. Just getting so many compliments. I wore a really nice dress for Thanksgiving, and so many people were just like, wow, you look so amazing. And it was just a really great feeling, you know. So, if you haven't gotten the surgery yet, just do it, man. Oh my God, it's just amazing. Just do it. Do it for yourself. You're just going to feel so amazing. And I have a friend who is really overweight. I just gave her all my old clothes, and they're kind of slightly tight on her. And she's been trying to get pregnant and she can't. And if she loses this weight, I'm sure she'll start popping out babies. But I kept trying to get her to do the surgery. She kept saying, "Oh, I'm scared. I don't want to do it." But I think once you start kind of submersing yourself in this world with other people who have gotten it, and if you find like a really great hospital that has like a really great program where they have classes and you can, because we went to Little General, and they had like a lot of great classes where you could go and meet with other, like they'd have like a panel of experts where they'd have like other people who got the surgery and they would kind of tell you tips, and they were very honest. They tell you how it is. They're like, your boobs are gonna sag, or all these things. You really, and then you look at the stats of the hospital and you realize like how many surgeries they do a year and how many fatalities there are. And usually the fatalities are if you're really, really old, or B, you don't take care of yourself after surgery. That's it. Most people, nothing bad happens to them. Unless you've got some really, really horrible things going on, then you really need to think about it, But there's really nothing to be worried about. Seriously. Really nothing. You just have to kind of make sure you take care of yourself after surgery. That's like the big one. Even if you're old and you have problems or whatever, that's not even really an issue. It's really taking care of yourself after surgery. That's the big one. But I remember hearing the stats for Little General, and like, I don't remember how many they did a year, but it was like a crazy amount, and it just keeps growing and growing and growing. And I think they opened up like another office in another town nearby. It's just like a thing that's going to keep, it's going to be end up like, oh, you're getting your tonsils out. It's really not that bad. So please don't be scared. Do it.